Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So today, as of today, we have 652 cases in total. This is up 15 from when I last reported on July the 21st, a week ago. We've had no new cases today, and over the weekend from Friday, we had a total of 6 cases. So as of Monday, 6 cases from the preceding Friday. If we look at those 6 cases, 3 are female, 3 are male. Their ages range from under 10 to in their 60s. All of them are in Simcoe County. All of them are sporadic cases. 2 acquired their infection in the community-acquired infections. 2 are close contacts of cases, and 2 are under investigation. All of them are under self-isolation at home, and 2 of them were asymptomatic, sought testing for various reasons, but didn't have any symptoms. So if we look over the trend of cases over time, in the last week, the week of July the 19th, there's been a total of 19 cases. This is slightly up from the week before, the week of July the 12th, where we had 18 cases. I would say one of the important things is that 2 of the cases that we've had in the past week have been associated with a long-term care facility retirement home outbreak at Georgian Residence in Simcoe County. That outbreak has involved 1 resident and 1 staff as a case. The resident is being treated in hospital at this time in the intensive care unit. We've had a total of 588 of our cases recovered. This is 90% of our cases. 4 of our cases are in hospital right now, which is unchanged from when I last reported. 1 in the intensive care unit. We currently have 21 individuals who are in self-isolation. We've had no new deaths, so a total of 36 deaths. Our last death was on May the 16th. And if we look at our trajectory, the reproductive number is 1.1. So anything above 1 means growth in the cases or growth in the outbreak. Anything less than 1 is a decline in the cases. So at the moment, we have a slight growth happening. In terms of our outbreak at Georgian Residence, as I'd indicated, we have 2 individuals affected, a resident and a staff member. We're presently testing all the individuals that either work there or are residents there. It's important to note that this facility is a complex facility, so it has some other residences that are available for use but aren't part of the retirement home, and so it's only the retirement home that's part of this outbreak. It's not the rest of the facility, just to be clear about that. So the great majority of the staff have been tested to date, and only 1 is positive. Of all the staff have been tested, we have 43 tests that have come back negative and 5 tests that are pending, awaiting the results. When it comes to the residents, we've had 3 tested, 1 is positive, the case. The others are negative, and we are awaiting the outcome of the other tests. If I turn to some of the issues that have come up via the media or social media, there are as follows. We expect this week that the Premier and the Minister of Education are going to make an announcement about the approach to managing schools in the fall, their plan for managing schools with regards to COVID-19. And of course, this is an issue that everybody is very attuned to, people are anxious about. Certainly, we all want school to happen, but happen in a safe way. It's very important for children's mental and physical health that they be able to return to school and if at all possible, that it be full-time for their well-being, and also for the well-being of families economically, to allow people to be able to go back to work as well. But it has to be done in a very safe way. And so we await the approach that the province will take in that delicate balancing act to be able to achieve that. We know that there are countries that have managed to do this successfully. We know that there are countries as well that have had outbreaks and have had to reclose schools. So I think that there's lessons to be learned from those situations to be applied to this decision that the province will be making. We were asked about my instruction to organizations and businesses about the use of face coverings or masks in indoor public settings, and specifically that I had not included schools. Just noting that there appears to be some background noise, so if people could mute their line, please, that would be great. Thank you. So anyway, my direction did not apply to schools, day camps, or childcare centers, and the reason for that is because there's provincial direction either in place for those facilities, those venues, or will be coming. So in the case of schools, that is coming, and we don't in any way want to supersede the direction of the province. We can't supersede the direction of the province with regards to these things. One of the things I would say is that it's important at this time for people to continue to remember all of the control measures that we have to abide by. We've had success in flattening the curve. We've had a bit of a bumpy road where we've had some resurgence and then control again, and some resurgence and control. At the moment, we've had a little bit of a resurgence, although the past day has certainly been good with no cases, and over the weekend has been good. But it's really all up to us again as the province opens up in stage 3 with venues and businesses. It has to be done in a safe way. That's one of the reasons why I issued my instruction about the use of masks and face coverings in indoor public settings to add to that level of protection, but we have to remember to do everything that's needed. So we have to continue to physically distance from other people. There's the 10 people in your social circle that you choose who are mutually exclusive about being close together. And you need to abide by that. Everybody in your group of 10 has to abide by that. And otherwise, with other people, you need to be maintaining physical distancing. And if you're in an indoor setting, you need to be wearing a mask or face covering. And you need to continue your hand hygiene, hand disinfection, and self-monitoring. And if you developed any symptoms, self-isolation, and seeking assessment and testing. So all of those things are critical for our success over time. We don't want the kind of resurgence that's been happening in the United States and is now happening in certain parts of Europe or Asia. Spain, for example, comes to mind, where they now are having a resurgence that's affecting their status in other countries in Europe, now requiring quarantine from visitors from Spain. So the potential for resurgence is real. We've seen some of it in other provinces as well to limited degrees, and we have to continue with our control measures. And we in public health have to continue with our surveillance and reporting to yourselves about what's happening, and our follow-up with cases to have them go into isolation and their contacts to go into isolation, and follow-up testing as needed. All of that has to continue if we're going to keep this under control and avoid more stringent matters or measures that the province could put in place if they have to. So looking at some of I guess one of the things I would point to about our data, if you go to our health stats website to look at our case count, we're enhancing this all the time. And one of the things that we've included is some data now about the age profile of our cases and how that's changed from month to month, because there's concern right now provincially about a surge in young people. And so if you look at our data, you can see what's happening with regards to that. There's a a bar graph called Age-Specific Incidence Rate of COVID-19 Infections by Month. And you'll see from March through to June each month how the age profile has changed. And basically what it shows is we had a lot more cases overall in April, and that the great majority of those were actually people beyond 65 and 70, and in particular those above 80. That's actually listed as an age-specific incidence per 100,000 population. So older people back then were very heavily affected. And then if you follow through to July, what you see is all age groups have come down over time, including young people. But young adults have lagged in that they haven't come down as much. And so they are now the dominant group rather than seniors. It's not that they've surged and increased in numbers, it's that they've just not come down as quickly as the older age groups. So more of our cases are young people, but it's not because we have a lot more cases than we had of young people. It's just that they've not come down as quickly. I've commented before that I believe this is linked to young people working, and that these work environments can put them at risk. Young people might be socializing more and relaxing their controls, having pandemic fatigue perhaps, and that can put them at risk. And also we've seen some family clusters as well that have involved people of a range of ages, including young people. So it goes back to the importance of protecting ourselves and our work environments, employers seeking to protect their employees with their practices as well as their clients, and everybody taking to heart the control measures that we all need to be practicing. So if I turn to the media questions that come up, they are as follows. As we head towards September, is the Health Unit going to be making recommendations on PPE and other measures to prevent COVID-19 outbreaks and spread in our classrooms and schools? So we await the announcement from the provincial government about their approach with schools, and we will no doubt support our schools and our school boards in their implementation. We have a very close working relationship with our schools and school boards. We do have a team here dedicated to working with our school boards. We have liaison positions to work with our school boards, and so they're an important group for us to be able to work well with schools about all things related to health, and right now in particular about COVID-19. So we will support the province, and we will seek to clarify any outstanding questions that might arise once that information comes out, once their guidance comes out. The next question, does the Health Unit have an estimate of how many non-lab confirmed cases of COVID-19 may exist in our communities, especially if in the early days people with symptoms were told to stay home and self-monitor without coming into hospital or assessment center for laboratory confirmation? And would these cases be reflected in the 31 cases reported through the Health Unit for Muskoka? So I would say that all along, we've known that surveillance in general picks up the tip of the iceberg, that in any surveillance we do on any condition, on any infectious disease condition, sometimes we're only picking up 10% or less of the cases that are out there. And that can be because people may not seek assessment if they have symptoms. Early in the pandemic, we didn't have the capacity to test everybody with symptoms, and so the criteria for testing were a lot more focused and restrictive on travelers and on people that were vulnerable to complications, and on healthcare workers. So there would have been many people with symptoms who simply couldn't get tested at that time, who may very well have been cases. Certainly some of them undoubtedly were cases. We know from other studies that have been done in other places in the United States, in Europe, that the seroprevalence of COVID-19 can be 10 times or more greater than the number of cases that are found through the acute testing that had been done. So seroprevalence means testing the blood for antibodies in a sample of the population in order to get an estimate of a percentage of the population that had been infected. It's another way of gauging how many people had been infected. And like I said, those studies can show that there can be 10 times or more as many people who had been infected versus the number that were picked up through the acute testing done for those with symptoms. And we have had a preliminary announcement from Blood Services Canada about a study they're doing on a sample of blood donations that have been made to the blood service. And they estimate under 1% of the Canadian population had seroconverted, had antibodies to COVID-19, had therefore been infected with COVID-19. So if we go with 1%, and we've got over 600 cases here in Simcoe, Muskoka, according to our testing, we've got over 500,000 people that live in Simcoe, Muskoka. So 1% of 500,000 is 500,000 people. I beg your pardon, I'm going to correct myself. 1% of 500,000 is 5,000 people. That would equate roughly with 10 times the number of people that we tested. That would be in line with what I've been saying, that typically surveillance can pick up a tenth of what's out there. The studies that have been done in other places that have correlated seroprevalence with their testing results have found that it can be 10 times higher, and the Canadian Blood Services estimates 1% of the population. That would give you, once again, as much as 10 times as many people in Simcoe, Muskoka who actually had been infected versus the numbers that we've detected through the acute testing that's been done. And that would be probably the same in Muskoka as it would be for Simcoe, so I wouldn't be able to give anything more specific for Muskoka versus Simcoe on that. So at this point, that's the questions that we've had to date. I'd be happy to take any questions that you have at this time.
Okay, thank you, Dr. Gardner. James Bowler from Cogeco, do you have a question for the doctor?
I do, and thank you for the opportunity. Dr. Gardner, I just wanted to ask about you're speaking about the resurgence, specifically looking like it's in the Simcoe area, but I'm wondering what you could attribute that to in terms of, is it to do with people not wearing masks? Is it to do with people relaxing other rules? You know, is there a specific sort of theme here that's causing this resurgence?
It's a very good question. Just over half of our cases right now are community acquired, so we haven't been able to identify a source. That, of course, is of some concern to us. Might be reflective of having moved into stage 2 and then stage 3, where there's greater potential with more venues for people to shop or work. Greater potential for people to get this infection and not know where they got it. So that goes right back to the importance of people being very cautious, abiding by the mask wearing in indoor public spaces, being cautious with regards to outdoor spaces. We've had concerns about crowding outdoor public spaces like beaches, and it's really up to people to space themselves well when they go to such places, or if it's crowded to choose not to go. So that's one possibility. We have seen some family clusters as well, and once again that can be related to people relaxing the control measures that are in place and choosing to get together beyond their social circle of 10 people and instead having more widespread contact with family members without the distancing. So I'm getting together with people in my family. If they're in my social circle, then I can be close to them. If they're not in my social circle, then we're getting together in a backyard, physically distancing 2 meters apart and being very cautious about maintaining that distance. So that would be another issue. There's been media coverage about parties and such, so that's another possibility as well, though that hasn't figured prominently in our data.
All right, thank you. And just as a follow-up, just something I've sort of been harping on a few times here. Again, I want to ask about, the infection, people being infected but going back to their own health units. We're in kind of a peak vacation time, especially here in Muskoka. It's quite busy. And it would be a very high possibility that people are coming here with, the infection, maybe not showing symptoms, getting sick here and then going back to their health unit. But we're really not getting a picture of, how high that rate is. So again, is there a possibility to be more open and transparent about that?
Yeah, from time to time, we've looked back and assessed how many people have been tested positive here, but then went back to their own community in another health unit and then provided that figure. So we'll do that again. I guess I've received that request enough that we could look at whether or not we include it as standing data on our health stats website.
Thank you, Doctor.
You're welcome.
Okay, thank you, James. Nathan Schubert from the Moose FM. Do you have a question?
I do not today, thank you.
Okay, thank you. Mike Harsalides from CTV. Do you have a question?
Yes, just mind the traffic here on 400.
Okay.
Doctor, good afternoon here. What do you have as a message to folks here in Simcoe, Muskoka, with regard to all this noise that we're hearing now, with regard to out-of-towners coming here, the Premier of the province bashing and chastising local municipalities here for the measures they put in place to try and limit or possibly divert folks from coming here in large numbers? Have you addressed that with local municipalities and tried to figure out a way to keep everyone happy and try and balance the interests of the economy, as it seems, with public health interests?
So certainly we've been working with our municipalities all the way along, and the profile of concerns has evolved with regards to migration of people here from out of district. And probably the major concern was from areas that have had a much higher incidence of COVID-19 versus here, like to the south. Early on, there was a concern about people attending their cottages, and then more recently, we've been focusing on large gatherings such as beaches. So from the very beginning of June, we've had guidelines that we've given to our municipalities about the management of beaches and other large outdoor gathering public spaces. They've come down to various ways to control the numbers and to encourage people to space out apart from their immediate social circle members, immediate household members, that they need to be giving sufficient space, the 2 meters space from others, as well as sanitation, such as access to washrooms and how they're to be kept. And the municipalities have worked hard to try to achieve that. We have succeeded in keeping our rates of COVID-19 quite a bit lower than south of here and less than half the provincial rate, and we want to continue to succeed with that. So this is an important goal for them. It's an important public health goal, and it's a challenge if part of the strategy in some instances is to reduce the amount of parking, or to change how they charge for parking, or to reduce some beach space, close some beaches. These are the ways that they are seeking to achieve that public health goal. And I would say that they are consistent with the kinds of approaches that we were recommending.
So have you at any point, as a follow-up to that, had any consultation with the Premier's office or the Ontario public health officials who are, quote-unquote, advising on this? And when you hear contradictory information, when you're hearing the Premier saying, look, you guys are gouging here, would you say that's a necessary measure from a public health perspective?
So indeed, I've been in communication with my colleagues across the province and at the province in the Ministry of Health. I'm on a public health measures table at the province, myself with a number of other medical officers of health, helping to give our input into guidance about major decisions that the Premier and the Minister of Health, the Medical Officer of Health would be making, about controlling COVID-19. And I certainly had raised the matter of migration, of cottage use, of beach use at those venues, made my concerns known, and had shared our guidelines as well. Actually, the guidelines that we have for beaches were put together with the collaboration of some other health units with similar challenges. So certainly there's been communication in order to not surprise anybody and to do our best to have recommendations and approaches that are reasonable and that have a reasonable chance of working.
Can I ask how those were received? Your concerns and your issues were raised?
So the health units that share our concerns, we're happy to share in producing and using the guidelines. Those at the province took it as information, there was, I would say, healthy dialogue about the issues that we were concerned about and the approaches that we could take.
Pretty much along the lines that we'll take it for advisement. Thank you.
Okay.
Thank you, Mike. Ian McLennan from Barrie 360. Do you have a question for Dr. Gardner?
Hello, Dr. Gardner.
Hello.
With the Education Minister to make his announcement sometime this week, I'm just wondering the contact that you've had with the school boards and they've sought your advice. If you could make the call just for Simcoe County and Muskoka, what best method of learning heading into September based on our situation in our area would you recommend for the school boards to implement? I'm appreciating it's the Education Minister that will make the call, but what do you feel most comfortable with right now?
Well, it's a balancing act of needs, and we know that education is critically important to the well-being of children. We know that their needs will vary by age. The disease transmission profile also varies by age. In adolescence, it's much more like young adults, the way it transmits and the likelihood of complications. It doesn't transmit as well in younger children. And although they can develop a rare multi-system inflammatory syndrome, it's mild and manageable, generally speaking. And so there's almost two groups to be considered, the younger children versus the adolescents, about transmission, and also about, I would say, their needs, their emotional needs. The approach that one would take about the control measures is going to be different between the two groups. I don't know what will come, but I think perhaps what will come is a difference in approach for younger ages, younger grades versus older grades. I would anticipate that, or would hope that there would be measures taken to allow for full-time attendance for the younger grades, younger ages, to meet their needs and meet the needs of families with regards to being able to get back to work, their economic well-being. The approaches probably, we'll see, but probably involve identifying cohorts of children to stay together in smaller groups to reduce the likelihood of a widespread transmission throughout a whole school, for example. If you can keep them into individual groups, that can help. There would be an emphasis on distancing to a degree that can be managed, noting that that's going to be a challenge. Probably an emphasis on protecting teachers, because they might be actually being adults, and maybe in some cases older adults, maybe older adults with pre-existing medical conditions, they might be at a greater risk. So you'd have to look out for their well-being with distancing measures. There would be the question of mask use and when it would be used. Mask use in younger children would probably be a lot more challenging versus older children who'd be able to comply with it better. There'd be the question of how do you transport children safely to school as well, and whether there'd be additional measures to be taken with transport, bus use, that type of thing. And sanitation, of course, would be, I'm sure, greatly augmented. There'd be the question of how much could be done remotely, and I think that that would be something that would be more feasible for older ages to do at least part of their work remotely, perhaps to reduce class size, to allow for more physical distancing. There would have to be, I think, changes in the directional movement of people, children through schools as well, to avoid, once again, crowding. You'd have to think through how do you stagger things to reduce crowding. So how much more emphasis could be given to outdoor education would be a good question as well. So a lot of logistics would have to be worked out. And we're just going to have to see what the details are that actually come forward. But those would be some of my thoughts. I would say a lot of emphasis on surveillance as well, looking for potential cases, having people screening, self-screening, screening children, certainly teachers screening and not coming to work if they're ill, exclusion of people that are ill. And then what kind of plans do we need in place to respond to potential outbreaks as well? Us in public health, working with schools, working with the broader healthcare system. So a lot to be worked out would be some of my thoughts about the whole thing.
Thank you, Doctor.
You're welcome. Happy to take other questions.
Erica Engel, go ahead, please.
Hi, yes. My question is about Bradford, where the incidence rate is nearly triple the average for the region. Are you looking further into that to sort of understand why it's been so high? I know they have a lot of outbreak cases, but even outside of those, their incidence rate seems to be pretty high.
I agree. So there's been, congregate setting outbreaks, and there's been agricultural outbreaks in southern Simcoe. I've never really specified exactly where. And there have been individuals that live in that area but work south of there and been involved with workplace outbreaks. And then there's been a certain amount of transmission that's been family clusters, and then community transmission as well. So I think it correlates well with the north-south gradient that we've had in the province. So within the province, you see a much higher concentration of cases, incidence per 100,000 population. The farther south you go into the Greater Toronto area and into Toronto itself, versus in Simcoe, Muskoka, where less than half the province's rate and about a quarter of Toronto's. But within Simcoe, Muskoka, there's much higher rate of disease of COVID-19 in Simcoe County versus Muskoka. And within Simcoe, there's a gradient north-south as well, so you have a higher incidence in southern Simcoe in the more urban areas such as Barrie, but in particular in southern Simcoe, which would be next door to the health units and municipalities that have had a much higher incidence.
Okay, thank you. Erica, do you have another question?
No, thank you.
Okay.
Okay, super. Elizabeth Smith from Rogers, do you have a question?
Yes, I do. Thank you. My question is actually around the long weekend coming up, and I just have a question about the 10-person bubble. Would you recommend, Dr. Gardner, if people are leaving that bubble because, as we know, some people go up to like a family cottage or something and they might have a different bubble, would you recommend that they get tested before they enter that new bubble?
So we do definitely recommend that people get tested if they have symptoms, that they seek getting tested, that they go to an assessment center to get assessed and probably tested. And if they've had a significant exposure, they certainly should self-monitor. If they're concerned, they can get tested. We find people who don't have any symptoms and have had no exposure of concern are extremely unlikely to have a positive test. And if they do have a positive test, sometimes it can be a transient positive followed by a negative that's difficult to interpret. Could be a false positive, or it could be or what we call, a remote infection that was in the past and this just was always asymptomatic. But for those who have no exposures and no symptoms, if they do get tested, it's unlikely, really unlikely to be positive. I think what would be key is if they're going to change into another bubble, everybody involved needs to be part of the decision. And they might very well want to consider putting themselves into isolation for a 2-week period before moving into the new bubble. That's a possibility, a possible way. And then if they're going to move back from that bubble into their other bubble, they might want to consider the same approach as a precaution. It'd be the most cautious way to avoid endangering new people in your new bubble. If people are just moving from bubble to bubble to bubble, or circle to circle, I should say, social circle, they really don't have a social circle then. It's kind of compromising the concept to a degree that makes it far less effective, and they're far more likely then to have transmission happening through these social circles that become overlapping and connected. They're no longer individual circles that way.
Okay, thank you very much.
You're welcome.
Thanks, Elizabeth. Dawn Huddlestone from the Huntsville Doppler. Do you have a question for Dr. Gardner?
I do, and it relates a little bit to the previous question. In terms of contact tracing, it's a two-part question. First, what could people be doing to aid in your contact tracing ahead of time? So, for example, keeping track of all the places that they've visited. But also, if someone does test positive, have you at this point considered releasing some of the more very public spaces to help with people who may develop mild symptoms but don't seek testing because they don't really think it's important to?
I'll answer your second question first. We have been focusing on high-risk exposure situations, and where a person has had 15 minutes within a 2-meter confinement without a mask, more so than with a mask. While symptomatic, right, we've been concentrating on those because they're far more likely to yield an individual who then becomes a case. We would go public with a location announcement if we found that it was a situation where there were those kinds of exposures in a public space and we couldn't identify the people involved by any other means other than going public. So there have been, for example, announcements about certain large-scale parties, for example, with large numbers of people in close confinement that haven't happened here but have happened in other health units. And in those instances, they've gone public about locations in order to help people self-identify that they might be at risk and allow them then to come forward, potentially self-isolate, certainly self-monitor, seek testing when indicated. So we would give that kind of information if we get into that kind of situation. But generally speaking, we haven't been in that situation. We've been able to identify the people that have been exposed and approach them directly. As for what can people do to make it easier, well, I would go right back to abide by the control measures in the first place. So take very seriously your social circle. And if you are encountering people out of it, maintain the physical distancing. And if you're in an indoor public space, use a mask. And beyond that, I think it is helpful to keep track of the people you've been in contact with. If you, in fact, have gone beyond your social circle and or for that matter, within your social circle too, if you've had contact with people and you keep track of it for when and where and the nature of it, it can make it a lot easier for us in our investigation if we have to ask you these things to have that information at your disposal. If you've abided by the control measures, then the numbers of people that we would need to follow up with are going to be far fewer than if you haven't.
Okay, thank you, Don. Do you have a follow-up question?
No, that's all for me. Thank you.
Okay.
Super. Doug Cross from Muskoka Region, do you have a question for Dr. Gardner?
Yes, hello, good afternoon.
Good afternoon.
I'm wondering if, as we see the trend to younger instances in Simcoe and Muskoka, is there any type of advertising program on how to reach this cohort with a directed message? Because there seems to be anecdotally an imperviousness about that age group. They kind of feel like perhaps they're not as big a risk. And so how do you reach that group versus the general messaging that we've been doing? Is there a playbook on how to reach specific groups?
I think that's an excellent question. I don't know if I have a good answer for it. The answer is we here haven't actually, to my knowledge, specifically looked at, say, the science of communication to young people. So I think that's a great idea. What would motivate them? I think we'd have to start with what are we seeing. So there's a certain amount of the social gatherings of peers concern that we would need to address. But there's also the other pattern of people at work. And that comes back not only to the individual, but the employer. So we'd have to, and we do, reach out to employers about workplace safety and the use of masks and distancing and hand sanitization, all the other measures that we would, the restrictions that are required for those work environments. And it's specific to the work environment, such as indoor restaurants or bars, and the 2-meter distancing between tables or barriers, if not, right? So there's different audiences to take this apart. If you want to help young people, it's not just reaching young people, it can also be their employers. There's also the question of people being cautious about family gatherings, and so that becomes yet another message for people that you've missed your family and you love your family, but unless they're in your social circle of 10, you've got to alter how you see them so that you're doing it in your backyard with physical distancing rather than making direct physical contact in your home. So I give these messages and we tweet them out as well. We use their social media to augment them. But I think there's room for consideration of refinement. What key messages for young people would work in particular? I think they probably are relying on the fact that they're less likely to have severe complications, but they can actually have severe complications. What's more likely to happen, though, is that they're part of the problem. They're part of transmission to other people who then can be at risk and have serious complications or die. And, I'm not sure the degree to which appealing to that argument would be effective or not. We'd have to look at the communication science, what would have to say about what would work for people, younger people, for example. So beyond that, Simcoe County is interested in carrying a campaign about mask use and supporting us in the messaging around mask use. I think that's an important contribution as well. And so we anticipate that they're going to be proceeding with that in the near future, and we'd be working with them on that.
All right, terrific. Thanks for that answer. This is my last call with you. Thanks for all your time over the previous months, and good luck.
Well, thank you for your coverage.
Okay, bye.
So there is now provision for child care centers, and they would need to abide by those stringent requirements from the province. That I guess would be yet a further task to have that running with associated with the schools as well. It is an important contributor to the idea of child well-being. It's an important contributor to family well-being, the ability of families to work, their economic well-being.
Is that a concern, though, that reopening school and then having kids go to child care centers before and after school, that's maybe too many points of contact?
It's a good question. I mean, with each step in the opening process, there is risk, and we've seen, a little bit of a bump up or a little bit of a surge, right, that can happen. Fortunately, it's not been sustained so far in terms of a surge. And I think as we get into that, we're going to need to watch that very carefully to see how that transpires. There have been outbreaks in some other countries associated with opening up of their schools. I've heard of that much more than daycare. Younger children tend to be less vulnerable to transmission than older children, adolescents. But the potential is there. It's certainly, I think, part of the landscape along with the inherent risk of opening up the schools.
And one more question, if you don't mind. I just see on the Health Unit website there's some discussion about testing, and 99 tests per 10,000 in Simcoe County, 103 in Muskoka, which is well below the provincial average. Just curious to know whether you have any idea why that might be the case and whether that's a concern.
I'm going to have a look at that because our recent data on testing showed that we were close to being on par with the province with regards to our per capita rate of testing. So I'm just going to have a look at that, if you don't mind. It's nice to have it right up there on our website. So when I look at the website, if you look at the Health Stats website under COVID testing, you've got a graph there that shows Ontario versus Muskoka versus Simcoe on a per capita testing rate. And it shows that the province, on its most recent data from the 20th of, I guess the week of the 20th of July, was a little bit higher than both Simcoe and Muskoka. The provincial rate was 121.5 per 10,000 population versus Muskoka at 103 and Simcoe at 99. So yeah, it looks like about a 20% difference at this point in time. And that's varied over time. If you go back the week before, then Simcoe was actually slightly higher than the provincial average. And the week before that, Simcoe was slightly higher than the provincial average. And the week before that, Muskoka was higher than Simcoe, which was higher than the province. So there's a certain amount of variation. I wouldn't be able to tell you exactly why it's a little bit down now compared with the week before, but on the whole, the pattern is that we've been keeping pace with the province.
Thank you.
You're welcome.
Okay, thanks, Chris. Is there anyone else in the line that we may have missed? Okay. With that,
It's Erica again. Do you think I could ask another question?
sure.
Okay. My question is actually about sort of the goal of control measures now. Is it that you want there to be 0 new cases, or is the goal to sort of keep the reproductive number under 1, or how would you characterize that?
That's a very good question. There have been places in the world where they've been actually able to achieve sustained 0. New Zealand, some of the maritime provinces, Newfoundland have had long durations of 0. And so that would be wonderful to achieve. at this point in time, what's most important is that we don't lose control of the pandemic, that we continue to keep it down, that we, if anything, have it continue to go down. If it does go up, that it be of short duration while we respond, that we don't lose control, that we don't have the kind of situation that's happened in the southern U.S. or in Victoria State, Melbourne City of Australia, or in Catalonia, Spain, where they've had a substantial surge and had to put in place stringent measures or lockdown measures. So I would say what's most important is that not happen, that we minimize surges and bring them rapidly under control, that ideally we continue to have a downward trajectory. If we do get to the point where we're having some periods with no cases, that we sustain it at that level.
Okay, thank you, Erica. Is there anyone else on the line we may have missed? Okay. With that, we will bid you a good afternoon, and we will see you next week. Thank you.
Goodbye, everybody.